Good morning, Julie. Good morning, Jill.
Good morning, Lisa. How you doing?
Well, apparently having technical difficulties on clicking what's new. I love your view.
Oh, thank you. The sun is probably going to be annoying for the next 5 minutes or so. So, good morning, Julie. How are you?
Good morning. Can you hear me okay?
Yes.
Okay,
Loud and
good.
clear.
I am
Perfect.
I am so new that I don't have a facilities card to get into the Chemeketa building yet. And so I'm sitting in my car with my Zoom on. So you're gonna have an amazing background once I get on video here.
Outstanding.
Yes.
True dedication to showing up for meetings. Yes.
Oh, well, I don't know about that, but like here, let's see if this will work. I'm on my phone for the first time.
Perfect.
There we go. Okay.
Nice work. Yes. Excellent. Nice to see you.
We're used to a variety of ways of attendance, Julie, so just all good.
Yeah. No judgment here.
Trying to make Did everyone have a nice long weekend?
Yeah, other than the weather could have been a little bit sunnier, I think, but
Yeah.
How cruel that it's
otherwise
sunny
it
now.
was- yeah, right?
Sunday was nice. Or no,
Absolutely.
Saturday. Saturday was nice. Yeah.
Morning, Jamal.
Morning, Jamal.
Hi, Jamal.
Hey, good morning. How's it going?
Good. How are you doing?
Great. Yeah, let's see. We've got quite a few folks already joining. Morning, Lisa. I see Dr. Chowdhury's joined, Dr. Hatler, Melissa, Dr. Sellers. Welcome to y'all, Dr. Shannon. Great group. Everybody's joined. So, yeah, let me pull up the slides for today, and then I'll hand it over to you, Jill and Lisa, to kick us off.
Sounds good. Will you let me know when we have a quorum? It kind of looks like we're close.
Yeah. Can folks put their name and organization in the chat? And while Jill's kind of going over the agenda, I will take attendance and make sure we've got a quorum. If you are in transit and not able to write in the chat, just come off mute and state that you're present, and we'll make sure to log that.
Good morning. This is Dr. Manu. I'm in transit, so I can't type into the thing. And then I represent Capital Dental Care. Thank you.
Thanks, Manu.
Great. Well, thanks for everybody being here early. I love it. So I just want to go over the purpose statement. We put it on there just to kind of keep us grounded at the beginning of these meetings. And our purpose is a panel that brings together diverse local healthcare provider perspectives to advise on best clinical practice, healthcare quality, and health information technology initiatives. So while Jamal's taking attendance in the background, are there any member announcements?
And Jill, while folks are thinking about it, just wanted to say that we've got most of the conflict of interest forms, our annual conflict of interest form from most CAP members. So appreciate those who have taken a moment to complete that form. If you haven't completed that, please do so as soon as possible. We want to make sure that we're in compliance with our bylaws as a council. So that's a requirement for all of our committee members on an annual basis. Certainly reach out to me if folks have questions on completing that form or or how to access the conflict of interest training, which is just sort of an 8-minute video that's on YouTube. Or any questions about the conflict of interest policy. Happy to help folks.
Perfect. And if there's no member announcements, so I'll open it up for general community questions, comments. And just a quick overview, Jamal has the agenda put up there so you can kind of glance through that, but there's no public comments. We can move on to the next slide, which is the CAP social event. So I know Jamal's been advertising for this Monday, June 2nd from 6 to 8, Chemeketa Cellars. Beautiful scenery, great time to kind of come and reconnect. And the whole thought behind putting this together was, since we're all on Zoom and really don't have much time to connect, I feel like there was a lot of energy in the room when we met for the Christmas awards celebration event. And I think it would be really beneficial to all meet in person to kind of connect, do a little networking, just put shoulder to shoulder and get this good work off the ground. There's a lot of good intention behind the people in this group, and I think meeting in person would be a good way to connect and continue the great work that we're doing. As a teaser, I thought I'd give like a quick 10-15 minute talk about fentanyl and its impact on youth in the area. So it won't be a boring, exhausting lecture. It'll be a quick little snippet on how kids are getting exposed and the new gateway landscape that we're facing. Important for not only us in healthcare, whether we're in the dental field or medical health field, but as parents, I feel like it's an important avenue to kind of discuss and learn a little bit more about. So if you haven't already RSVP'd to Jamal, we did decide that a +1 would be lovely, so you can bring your partner and have a lovely event setting at this beautiful Willamette Valley and connect with the folks that are working hard on this panel.
Awesome. Thanks, Jill. And I am tracking the weather for this event. Looks like it'll be somewhat of a warm day and we'll have a nice sunset at that time or sort of like the lead up to a nice sunset. So would love for folks to come join us and connect together.
It's a perfect pivot to the next topic, which is introducing, there's 2 panel member nominations. We have Dr. Mark Buchholz and Julie Gannett, and I'm excited to be able to see Mark. I've worked with him for years and years in the pediatric realm of things. He's been an exceptional advocate for children. And reading through Julie's resume and everything, it's like the spectrum from kids to geriatrics in terms of their passion for implementing creative initiatives for health improvement, health quality care, and really connecting multidisciplinary team members to really advance healthcare in our changing healthcare landscape. So you have all had time to read through their resumes and their personal statements. So I wanted to open it up and see if Mark, if he's here, I'm not monitoring the chat, but if he's here, could jump on and maybe say a few words.
And I don't think Mark was able to join us
Not able to
this
make it.
morning. So
Okay, all right. Julie, are you able to jump on and say a few words?
Yes, I am. Can you hear me okay? Okay.
Yes.
I'm coming to you live from my vehicle as I'm in between my building. And anyway, yes, thank you, Jill. That was a very accurate description of sort of the width and breadth of my experience, as well as my interests and my passions in healthcare. I came to healthcare quality improvement in 2005, and that was when integrated healthcare was sort of just between behavioral health and physical health was really starting to blossom. And it really ignited a passion for me for not only for the integration of behavioral health with physical health, but just generally breaking down silos in healthcare and partnering and producing better access to care.
Perfect.
So,
Very good. Well, thank you, Julie.
yeah.
And
Very
since
happy
we've
to
all
be
had time to if we've all had time to look through everything, I wanted to open it up to see if there's anyone who's willing
And-
to make a motion to vote on these members.
And really quickly, Jill, just to confirm, so we do have a voting quorum today, so we're good to go.
Perfect. Awesome. Thank you.
Jill, this is Lisa. I will open and bring forward the nominations for both.
Perfect. Thank you, Lisa. And so now
I
that there's been a
second.
motion, we
I
have a
second.
second.
This
Thank
is
you so
Manu.
much. Thank you, Manu. And I feel like we need to just offer up a vote of those in favor. Say aye.
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 Aye. Aye.
Okay, are there any nays or anyone opposed? Okay, and then does anyone abstain? Perfect. All right, looks like we have unanimous votes. Very excited to have both of you jump into this team. This is a really exciting time. I think you're going to bring some rich experience and some thoughtful conversation to moving some of our projects forward.
Thank you.
All right, Jill. I'll go ahead and give a little bit of an update on one of our funded initiatives from 2024. Angie was out sick today, so I'll sort of give a brief update on some of the work that you all funded as advisory panel members through the Willamette ESD. Huge shout out to former co-chair Dr. Bruce Sellers for championing the work around better coordination and supports for kiddos navigating intellectual and developmental disabilities and making sure that families are connected to resources. So this is one of those initiatives that was funded through Dr. Sellers' co-chair initiative last year. So Willamette ESD has been funded for their IDD Family Outreach and Awareness campaign. Again, this is to ensure that families are aware of what the resources are for young children with developmental delays and disabilities. Throughout 2024 and into 2025, they've successfully printed and distributed 5,000 multilingual brochures. That includes brochures in Spanish and Russian. This is to increase the awareness about supports for children with developmental disabilities. They've been able to partner with amazing groups and partners in the community, such as Creating Opportunities with Cheryl Cisneros, Family Building Blocks, both the Santiam and Polk County Service Integration teams, as well as the Marion Polk Early Learning Hub. I will say, as a father who is also sort of navigating the complexities of the system, this has been an incredible resource, and I'm so thankful to Willamette ESD for bringing this forward, particularly on the right side of the screen here. It's a little bit wordy in terms of what you can see on the screen, but it's such a helpful resource for families to understand when faced with suspected developmental delays in our children and our youth. There is a resource to understand how best to get connected and navigate the medical system, the education system, county health programs through Marion and Polk County, as well as other community opportunities. So just an incredible resource here. There can be so many complexities for folks in navigating how best to connect to services and supports. And so really thankful to Willamette ESD for bringing this forward and their partnership with Creating Opportunities, as well as you all for making this a possibility and helping to drive this forward in the community. So just a quick update there. I'll pause and open it up for any thoughts, questions. One more quick thing. So I know that Angie and Willamette ESD are looking to connect more so with healthcare providers in sharing this information and allowing those healthcare providers in our community to utilize this as a resource as well. So we can put a link, or we'll sort of attach the flyers in the chat. I'll try to get that in the chat here, but certainly include this in the follow-up materials that go out after this meeting if folks want to share this with your organizations. Okay, so now I'll open it up for thoughts, questions on the wonderful work from Willamette ESD. Okay, and again, this will be included in the follow-up materials that go out to you all following the meeting. So reach out to myself or Willamette ESD if you have any questions. Happy to make that connection with the folks over at WESD and continue to ensure that there's more and better coordination of these important services and supports for kiddos. All right, with that, Jill, I'll turn it back to you. Jill and
All
Lisa.
right.
Yeah.
Do we have Anne here or Shannon that can give an update?
Let me check if they were able to join here. Yeah, Jill, I'm not seeing that they've joined, so we may need to check in with them and follow up on the hepatitis elimination plan. I'm not certain what the mix-up is, so I'll confirm with them and see if we can get them on the line.
Sounds good. Then we can go ahead and move to the next agenda item.
Good morning,
Lisa,
everyone.
you here?
Yeah, good morning. We wanted to just give you all an update as to where we're at with the Marion Polk Action to Care Subcommittee update. We have had our first kickoff meeting. It was April 11th. And as we indicated, I believe last month with the check-in, that we postponed the May meeting so that we can recalibrate and make sure that we are in sync with, we had some technical challenges and we had some follow-ups from the first kickoff meeting, which we needed to address with regards to the charter. And we had opened it up for additional attendance for members in the community that would like to be a part of this. And I should step back and just recap what this is. It was a meeting from this group, a subcommittee, to be good stellars of the shared savings amount of 1.35 million. So it is an action-oriented, ready to deploy assistance to our community to improve the community. But this is an up and coming event and more to share at the next meeting. Jamal? anything else to add?
Yeah, thanks, Lisa. Certainly looking forward to make the most of the time that folks are committing to this group and ensure that we're able to rapidly drive those investments into the community in ways that improve access to primary care, behavioral health care, as well as oral health support. So we'll look towards our next meeting on June 13th to bring forth additional information. Okay. And with that, Lisa, I'll go ahead and provide an update on our Social Care Impact Fund. So the other funding source that the Clinical Advisory Panel is overseeing. So our Health Innovations and Investments Work Group is gearing up to evaluate the many requests that have come in for the Social Care Impact Fund grant. So just a little bit of background to refresh folks. CAP has been tasked with investing just under $1.9 million in quality incentive funds in building capacity and infrastructure to support children's social emotional health as they're getting ready for kindergarten, as well as the community's social determinants of health needs. So there's two quality incentive metrics that are sort of the underlying funding source for this opportunity. So throughout the later part of 2024 and into 2025, the Health Innovations and Investments Work Group structured the parameters for driving these funds out into the community, which resulted in the Social Care Impact Fund. So that application window was open from April 4th and just closed last week on May 16th. Or was that last week? That might have been the week before. Anywho, we are preparing for evaluations as a work group. So I believe our work group members will be receiving the applications today through our Foundant grant tracking system. We received 45 total applications from the community from a good mix of healthcare provider organizations as well as community-based organizations. 35 of those applications met eligibility criteria and are now moving on to be evaluated by our work group members. We do anticipate that we'll sort of finalize the results of those evaluations by June 18th and prepare to kick out notice of awards to entities that have been awarded. We'll work with those entities to get letters of agreement signed in the early part of July and funds out to those entities in July for projects to begin in August of this year. I do want to extend just deepest gratitude to our work group members who are carving out a couple hours in the coming weeks to ensure that the funds that are going out to the community are positioned to make as great of an impact as they can for Marion Polk children's social emotional needs, as well as the entire community's social determinant of health needs. So very excited that we've reached this milestone, and very thankful to our work group for driving this process forward. I'll pause there. Manu, I see you've got your hand up.
Yeah, just a random question, sort of the 43 that applied.
45.
Or sorry, let me restate the question. Of the amount that we have set aside for this process, or the amount of money that we've set aside for the process, do we have the capability and ability to fund all 43?
I think, yeah, so Manu, I think it comes down to a matter of impact, right? So throughout across the 45 applications that came in, the total requested amount was about $9.5 million, certainly well above the $1.9 million that we have associated with the quality incentive funds. And so it's part of what the work group will be discussing in terms of how do we ensure that organizations have the funds that they need to make the impact that we're hoping for. Whereas at the same time, ensuring that there's a large enough impact to move the needle for kids and families in this region, as well as our regional performance on those quality incentive metrics. There is a question on the application, so applicants are aware that we may not be able to allocate the full requested amount that an entity had put on their application. And so part of that application is asking them to indicate how their project could scale up or scale down based on the amount of funds that are awarded. So I think, yeah, Manu, to answer your question, technically, certainly can, but I think that it brings into questions, if funds are being spread too thin, is that actually creating enough of a difference for entities to drive the impact that we'd hope for?
Okay, thank you for sharing that information. And also that was smart to add that question about scaling down and scaling up. So that was great that you included that. Thank you.
Yeah, and I have to give all the credit to our wonderful grant management team, Melissa Lindley and Ali Moore here at the council. They've been amazing in setting up this process and guiding us through the Foundant grant process. And so all credit goes to them. So yeah, thank you to both of you. Okay, and Jill and Lisa, I'm not seeing that our partners at OHA have joined, and so we do have some additional time here. I'll need to kind of circle back with them and confirm if we can bring them back for a subsequent meeting and ensure that we can connect on the important information that they have around hepatitis. But let me turn it back to the two of you if there are other matters you'd like to discuss with the CAP, or if we want to adjourn early today.
Jamal, this is Lisa really quick. Is it possible with their time on the agenda at 8 a.m. that maybe they just haven't joined yet?
It's certainly possible. If you want to give me a moment, I can sort of text Ann Chackwin and see if they're able to join. So I'll kind of go on mute for a moment while I try to connect with them. And thanks, folks, for hanging on the line here for a moment. Lisa may be right that they may be joining around the 8 o'clock mark. I did want to say thank you to Dr. Chowdhury. I see that you've RSVP'd for the social event next Monday, so looking forward to seeing you there.
Jamal, do you have a head count yet? I was curious about that while we're waiting.
Yeah, there's been a few more that have come in, so I think we're up to about 10 or 11 folks joining us thus far, and so we'll look to kind of beef those numbers up a little bit today.
And Jill, I'm just free speaking here. I'm curious, we have as the co-chairs, just a real desire to want to connect the members. And so I think it would be helpful for those that aren't able to attend, if we could just receive some information around that, if it's time, and what might be a more easy to attend time in your all schedule. We're really, like Jill said earlier in the call and the kickoff, it's really important to us to be shoulder to shoulder and see what topics we could bring into this group and build relationship and understanding of one another and our roles in the community. So any input around that and future face-to-face events would be extremely helpful. And we're very passionate about finding out how we can get us all together.
And did you say it was 6:30 on June 2nd?
6 p.m. on June 2nd.
6 p.m. on June 2nd. Okay, I will double check my calendar.
Wonderful.
And it's drop in enough, Jamal, correct? If you can't be there at 6, but you can be there, 7. We welcome everyone.
Yeah, certainly. We'll have some desserts as well. I think there will be some cookies and some refreshments, so should be a lovely time. We've reserved the tasting room at Chemeketa Cellars as well as the back patio, so we'll be able to kind of enjoy the nice weather and just really connect as a group. Yeah, and Lisa and Jill, no word yet back yet from our partners at OHA.
Do you want to move into me wrapping it up and next steps then?
Yeah, certainly.
Okay. Well, again, thank you all for being here on the first day after a long holiday. We really appreciate your time and the purpose of us all being here. As Jamal shared at the beginning of the meeting, if you haven't completed your conflict of interest form, please do so as soon as possible. And if you have any questions about the training, you can reach out to Jamal for assistance in that. As we were just discussing, the save the date is next Monday, June 2nd from 6 to 8 p.m. with a +1. So please come. We look forward to hearing from Jill and what she has to share with us about a very important topic in our community, as well as just that face-to-face connection. We want to welcome the 2 new committee members that we have nominated and approved, and we look forward to their ongoing participation. It looks like we will have an update and move the OHA hepatitis elimination plan topic for an up and coming meeting, and more to come on the MPAC subcommittee. And our next meeting is June 24th. Did I miss anything? Any comments?
Yeah, the only other thing is for the Social Care Impact Fund.
Okay.
We should be able to give the CAP a readout on the organizations and initiatives that are being awarded a grant at our next CAP meeting.
Awesome. With award notices going out around June 27th, you shared.
Yes.
Well, it's 8:01 with that.
All righty. Well, thank you all, and we'll talk to you soon.
Thank you.
Take good care. Bye-bye.
Thanks,
you.
everyone.
Thank you.
Bye.